The Health Minister is live in the studio. Edwin Poots, are you satisfied that after the initial outbreak in Altnagelvin in December, where a baby died, that the Belfast Trust took all necessary steps to protect babies at the Royal?
Well, the Belfast Trust has indicated that they did. Now, it'll be something that we will test over the course of the next number of weeks. At this moment in time, our number one priority and our main task is to actually get on top of the problem, ensure that we minimise the numbers of babies that get infected by this bacteria, and ensure that lives aren't lost. After that is completed and that course of work is done, will be the time for investigation, and we're very happy to do that.
Let me take you back in the timeline, because a letter was sent by the Chief Medical Officer after this death in Derry, reminding trusts about potential risks to check taps. Were the trusts told about the death in this letter?
I understand that they weren't told about the death. This letter reiterated advice that went out in 2010. Indicating the steps that need to be taken in terms of hospital hygiene in these facilities. Obviously, neonatal units are facilities where babies have a very low immune system, and therefore we have to have the highest standards of hygiene in order to avoid these things.
On the back of this letter from Dr. McBride, did the hospitals then check the taps?
Well, the hospitals obviously went through a course of work. Belfast Trust have indicated that they have done everything that was asked of them, and we will investigate that in due course over the next number of weeks and months.
When were the taps finally checked in Belfast at the Royal?
Well, they were checked some time ago, and we have been waiting on test results coming back. It takes some time for these test results to come back. It has been confirmed today. I welcome the fact that we have that confirmation. We know where the source of the problem is, and we can respond to that.
The chairman of the Health Committee, which scrutinises your department, says that things weren't done quickly enough. Would you agree with that?
Well, again, I think there'll be a time for us to investigate that and to clarify that. Clearly, there's a course of work that has been done. This was drawn to my attention last Wednesday, and we have engaged in very intensive work over the last number of days to get on top of this situation.
Babies were transferred out of the Royal Maternity Neonatal Unit to other hospitals. They would have been without the Pseudomonas. But given that Pseudomonas is in other units now, is it possible that even though they were not showing signs of the bug, that it could have been with them, and it could have grown sometime, been exported?
Well, the baby that was transferred to Craigavon, who exhibited signs of Pseudomonas after it arrived at Craigavon, has now been discharged from hospital and is well enough to return home. The baby in Antrim is colonised and isn't impacting upon any other children. Are you saying
that they wouldn't have been exported?
Well, we haven't got that evidence at this point, and this is a very fluid situation. The information that I give is the information that has been given to me.
You have a golden opportunity now to reassure the public, particularly expectant mothers, that everything is going to be okay. Can you do that? And also the units in Craigavon and at Altnagelvin?
All of the maternity hospitals are operating normally. We have no difficulties, and expectant mothers can have that insurance. Our neonatal units have had a problem with this particular Pseudomonas outbreak in the Royal Jubilee. However, we have been getting on top of that situation. We've identified the problem, we've identified the numbers of babies who are carriers of the Pseudomonas, and I trust that over the course of the next number of days we will be able to eliminate it.
Edwin Poots, thank you very much.
Thank you.